Yes, we welcome you back from that relive of His Excellency John Yoweri Kaguta Museveni and His Excellency the Deputy President of Kenya, William Ruto, at an event in Matuga a few days ago where they launched a vaccination plant. And now welcome to UBC News Tonight, the second edition. It's me, Michael Jedan Lukomwa, with Mohammed Mugalu. We'll start with a look at the top stories. Security on high alert as South Sudanese enter Uganda for food. Moyo Treatment Center needs oxygen cylinders. UNA boosts health workers attending to COVID-19 patients. While SC Villa in sports, Congress sets aside 28th of August as club elections date. UBC News Tonight, welcome aboard, and this is what we have for you. The Ugandan security at the Legu border is on high alert following a move by South Sudanese to cross to Uganda against COVID-19 guidelines in their country. According to officials, the South Sudanese started forcing their way to Uganda after noticing that there was food being offered within the refugee camps. The Parliamentary Committee on COVID-19 in the North urged the security officials to tighten the patrols along the border points to prevent the entries during this lockdown.
We have been assessing the status of response to COVID pandemic all over the country. We are a team which had come to northern Uganda, and this particular point is one of our area of great concern. You are aware that Amuru district is the epicenter, is one of the hotspots in as far as the pandemic is concerned. And definitely the entry point, the most serious part, is the Legu border point, where people cross from Tanzania, from Kenya, from Sudan. So it will be a hotspot. Now, our coming here purposely is to assess the readiness of our team, of the country in terms of response to COVID. How do they control entry and exit of persons in and out of Uganda? In terms of COVID, the COVID context, the method of testing, the border controls. Right now, you can see across many Sudanese intend to cross to Uganda even without any test results, and this one increases give a very serious risk to citizens of Uganda. Definitely, I think this for me is a good control. The border always closes at 6 o'clock. We are seeing a lot of struggles. And by the way, in this case, you should also expect that you never know. Some of them, a wise one, can sneak even through the waters. So I think what I've observed is that the security need to be a bit more serious, increase vigilance to ensure that people who are not tested don't enter into the country.
Now you have another situation where you see there are people from Sudan who really want to come in, I would say virtually by force. Because I'm told at the moment food is being distributed in the camps. So they want to come and get the food, and then they go back. But our security people have to virtually fight with them to make sure that they don't come in. And if you look at the kind of numbers which are coming, and you see that it is just Amuro, not the Ministry of Health, manning the port health here. You would imagine if the security relaxed a bit, even the port health people would be overwhelmed because they are quite a number. So that is what we have seen. And our thinking is that when we go back, we will still insist that the ministry should take up the issue of port health, and they shouldn't leave it to the district local government.
Moyo Hospital COVID-19 Treatment Center only has one oxygen cylinder, the worst equipped hospital in the whole of West Nile region. This situation, according to the medics, escalates COVID-19 deaths, calling for an urgent intervention by the Ministry of Health.
This magnificent building houses Moyo Hospital COVID-19 Treatment Center with a bed capacity of about 30. The facility is one of the most organized treatment centers with high bed capacities, but the worst equipped hospital in terms of oxygen cylinders.
Actually, for COVID management, one patient needs all the 5 cylinders. For now, it means if we get a case in oxygen, which has been the case in the last few weeks, it is not possible for us to manage. We can only give pre-referral oxygen. Right now, what we need urgently is to have over 25 cylinders. That means we shall have a capacity to engage in at least saving 5 lives for 5 people who are severely affected by COVID. And we also have ventilators designed and developed in our rooms, but they have never been functional. We are requesting that the ministry should take it up seriously.
The hospital also lacks oxygen plant, and the nearest point to fill the cylinder is in Arua, which is about 150 kilometers.
Just send them messages that we are coming for oxygen, and then we have to look for suitable transport to carry those cylinders because they don't fit very well in our ambulance, which is the transport we have. At least if we had a pickup maybe, or a mini lorry, then they are able to refill. Refilling does not take us much from the other side. It is filled on spot, but the truth is the cylinders are not adequate, and also the supply is inadequate.
The medics at the hospital have also claimed that they have never received any medicines from government for treating COVID-19 since the outbreak of the pandemic last year.
And all the patients buy their medications in totality. We have no special supply for the hospital, neither do we have a budget. If we are to interfere in that budget, it means stockout will be overwhelming the hospital, and it will not be useful enough for or beneficial to the rest of the communities. So we have not received any drugs at all, if not even from the regional node, but we got some few from the communities that gave us here, which could not be sustained. At the same time, we are also unable to provide food for those who cannot get. It is really a big problem.
It should be noted that Moyo district borders South Sudan, hosts thousands of refugees, and has more than 7 porous border points that exposes it to COVID-19.
Our coverage is wide. Obongi district has a health center 4. Obongi became a district 2 years ago. They have health center 4. In emergency cases, referrals are received here. Obongi Ferry is no longer working. Previously, we used to share the responsibility with the Ajumani district, Ajumani hospital, and Moya. But now, because every pressure is on Laroki Ferry, so the nearest is here. The refugee community, the referrals are made here.
The Parliamentary Committee on COVID-19 that visited the hospital for an oversight role condemned the situation, blaming it on both local and central government.
Noting that a patient with severe COVID needs a minimum of 5 cylinders per day, that's a huge gap that must be addressed urgently. So we've guided the case management team to plan for and order for cylinders and work with the Rural Regional Referral Hospital and possibly Gulu Hospital and the national medical stores to ensure there are oxygen cylinders, but we also need oxygen concentrators because there's only one oxygen concentrator that is working in the hospital.
Very big challenge that we've observed. They have 1 cylinder, but that's not even the biggest challenge. The biggest challenge is that refilling that cylinder itself, they need to spend about 400,000 shillings in terms of fuel to go all the way to Arua and get it refilled. The second option they have is to have it filled from national medical stores. We've seen that Jumani getting it refilled from national medical stores, which is a very long process, takes about 1 month for them to complete. So there is need to support them to have more cylinders as we look at future plans of having a plant to manufacture the oxygen locally.
Moyo has so far admitted more than 374 cases since last year, with 16 deaths and 288 recoveries. Philip Aguta, UBC News in Moyo.
While the number of coronavirus deaths is now above 2,000 in Uganda, most people who contract the virus go on to get better. Some people experience relatively mild symptoms or even no symptoms at all. Others have no option but to opt for hospital treatment. Sam Gombia, a musician who developed COVID-19 and recovered through home-based care, shared his story with our reporter in this one.
You just have to accept that there is COVID in Uganda. This is not China, this is not Italy, but Uganda, where you also, we have COVID within our Uganda.
Sam Gombia is a musician, radio presenter, husband, politician and social activist for people living with disabilities. Gombia says he is lucky to be alive after suffering from coronavirus. He managed his condition at home with the help of a qualified medical personnel and is appreciative to God for seeing him through his sickness. He says that he had splitting headaches with his body on fire, prompting him to go for a checkup at the hospital. Gombia says that he was ready for any eventuality, but upon receiving the results, everything changed.
On receiving the results that I'm positive, things started changing a little bit. So I started getting some symptoms that I didn't even had before. The body started itching, by the way. The body started itching, and then I said, yes, this is COVID now.
Because of fear and anxiety, using his prescribed dosage by his physician, he bought drugs for the entire family.
So I had to buy that kind of medicine, which took around 700,000 shillings. Sweet. So there was Syria. Why? Because I was scared. And I thought also my family needed that. You don't know, because we've been together before isolation and whatever. We've been together sharing this and that, eating together, so I thought we are all sick.
He was self-isolating at home from the rest of his family, but eventually his wife Sophia Gombia contracted the virus, but children were lucky not to be infected.
But I looked at my children, they were taken. And the daughter didn't welcome the news very well, and I saw her face. But I told them I'll be fine, there's no problem. And then eventually, she also got some symptoms after a while, after some 2-3 days. And we found out she was also sick.
Gombia felt so lonely and also thought that he was about to die. This made him to almost share his secrets with wife and family.
I got some difficulties in breathing, and then I said, yes, this is the last symptom now. So I thought, man, I'm going to die. And in there, that's when you come up with the secrets that you had kept to yourself. I said, no, man, I have to disclose my secret.
Gombia says he got nightmares of him being buried.
You start dreaming about your death, you dying, taking you for burials and whatever. That kind of dreams.
As many COVID-19 patients are charged exorbitantly, it was a different story for him and family as they opted for home care treatment.
We used up to 5 million, not because we would have used that money, no, because I was a little bit extravagant, because I was scared of the disease. Like the medicine I bought is still at home. Because I bought a lot, whatever they tell you to. I even changed the doctor's description. He described a certain medicine, and then I went on changing because I had listened to another person.
He appealed to Ministry of Health and Health Centers to change the way they relay COVID-19 results to their patients, since people are in panic.
From the blue, you're positive. Next. So what, how have you left this one? What if he goes out without being inducted into it? You will find a problem to embrace the entire COVID whatever he has to. So, but if you prepare him that, yeah, no, like the doctor talked to me, he talked to me nicely.
Sam Gombia has a special message to the people still battling coronavirus and the nation at large.
Accept it. Do not doubt that maybe the doctor this, that. Go according to the doctor's advice. If it is medicine, take it the way he has described it to you. Don't think that you're jakubera bulungi without taking the doctor's advice.
As of 16th July, the Ministry of Health had registered 89,080 coronavirus cases, of which 2,249 had passed on and 64,096 recovered.
COVID-19 is real. Uganda North American Association President KENYATTA Wamala has appealed to all Ugandans to embrace the vaccination program. She says hand washing, social distancing, face masks and vaccination are some of the proven protection measures against the COVID-19 infection.
The President, Uganda North American Association, KENYATTA Wamala, has commended government for protecting the citizenry against COVID-19. Wamala says many countries across the world, especially the European countries, have fully supported the vaccination program, and this has helped them to control the pandemic, unlike in the previous lockdown. This was at a handover of a sorted sunrise to healthy workers treating COVID-19 in government health facilities at Kasangati Wakiso and Wabusana Luwero. The event concerned with touring around government facilities under construction at Wabusana.
A chance when the government lets you know that there are vaccinations, please go and get vaccinated, because we need to get back to where we are. We cannot be locked down forever. And I also want to join the African leaders that have been calling on to the Western world, that have promised to send vaccinations to Africa. Please, we beg of you, send us those vaccinations, because we are your partners. We don't want to be beggars, but we are your partners. We are your partners when it comes to to building the economies, that is the economy in Africa.
Accompanied by the special envoy, UNA Zephania Chiza-Seninde, among others. UNA donated masks, hospital gowns, gloves, among others, which were also donated to government health facilities at Kamoli, Iganga and in Jinja, Busoga region. Health workers commended UNA for the support in this challenging period of the COVID-19 pandemic.
Our brothers in the Uganda North American Association who have made this timely donation of personal protective.
Okulabanga mwami Seninde yakwana ekibiina kino ekyayona okusakira ebintu byaffe bigenda okukozesa mu malwaliro gaffe.
The UNA Special Envoy Zephania Chiza-Seninde commended President Yoweri Kaguta Museveni for the conducive environments for Ugandans in diaspora who can now participate directly in supporting their motherland socially and economically.
Very grateful to see that our doctor, our president, has been able to visit us. I cannot forget to thank His Excellency the President and the staff of the State House, who have been helping us a lot to see that most clinics outside Kampala are being developed.
A 15-year-old primary 7 pupil in Iganga who gave birth to twins during the exams has regretted conceiving, which led her to fail her PLE exams, but now willing to go back to school. Milsa Naiwumbwe gave birth to twins during her 2020 PLE exams, but performed poorly.
A primary 7 candidate who gave birth to twins as she was writing her primary leaving examination in Iganga district has scored poor grades. Milsa Naiwumbwe, who is currently staying at the home of the man who impregnated her in Kakombo, Nachigo sub-county in Iganga district, says she failed because of the inconveniences of pregnancy and breastfeeding. However, the victim says she is willing to go back to school if she gets sympathizers. When asked why she stays at the man's residence, she said that she was told that twins have to stay at the father's home. The husband regretted the incident, saying she is free to go back to school. Christine Nachintu, the boy's mother, also says that the girl stays at their home because of culture and she is free to go back to school if she wishes.
Mama umaza egwali babe galala bakoleki bakuma abaana leero betegeranga tyamuna ebintu bivavize bulungi ate yajja asome yazira kubo itinasoose kuba labanga asomye bulungi ngabisemu asobola okuyamba abaana.
Meanwhile, some of the candidates in Iganga district who passed well celebrated from their homes in strict guidelines of COVID-19.
We want to thank the children because during their stay here and being young at those ages, we really had to ensure that enforcement of the SOPs was a must. We have to say we thank them for having abided by the SOPs, and I think it is one of the reasons that has put us to celebrate today, because had it to be that some of them had fallen sick, maybe we would have closed and we wouldn't have had the chance.
It was the other time before COVID. We would receive our girls, our candidates now, we receive the parents, our teachers, we come together and deliberate. We thank God, you know, we share each and there, but as of now, we find that we cannot access them because of the situation. You fear, and by the way, they cannot even access, and even the minister was not in for that. We can't. So I've really missed them. We are even ourselves as teachers, we fear each other because as we are in different areas, you can't tell who is coming, what is that person coming with. So that it really has brought some kind of fear. So we have not really enjoyed, though we would have enjoyed if it was not this.
After the release of the PLE examination results, celebrations were straight away held in candidates' homes. This was opposed to the days before the COVID-19 pandemic when the jubilations were held at schools.
The 2020 Primary 7 candidates performed well this year despite the existing lockdown that saw different schools closed in the country.
I'm happy about the performance. I expected more first grades, but because of COVID, they've been cut because this particular class from the beginning of it was doing very, very well.
Dorothy Ajilongo Reno, who is currently supporting her parents with domestic chores, was quick to celebrate her success in the 2020 despite the lockdown.
I'm Ajilongo Dorothy. I got aggregate 5. I got 5 aggregates. And I want to thank God, my parents and my teachers for helping me through this time. It was a hard decision taking your children to school because you'd worry what if they get COVID, what if they what, but still they trusted God and took me to school, and I thank them for that. And I would also like to thank my teachers because it really wasn't easy. We had to manage to cover all the topics and then revision and all that.
As parents, you know what we went through. The COVID situation was very difficult, very stressing. But I'm so surprised that these children did not let us down. And so is the reason I'm so happy. Thank you so much, Dorothy. I wish you blessings. You should achieve what you want.
Despite this COVID situation, things have been hard, reading has not been easy. She still made it.
Atohara Boki Maria, who topped the performance at Shore Prospects Primary School, benefited from regular consultation with her teachers.
First of all, if you want to do something, you first have to set a target, a purpose and a goal so that you know what you're working hard for. I really want to become a doctor when I grow up, a doctor or an engineer.
Kubanga mbadde sizisuubira okusinziira ebibuuzo engeri gye nabirabamu ebibuuzo tebyali byangu kutwaliza wamu mu ngeri emu oba endala.
Because of my teachers, they taught me very well and they trusted me.
Sadam Bale, UBC News, Kampala.
Schools have not made their usual celebrations after the release of PLE results. Schools across the country, including those in Mukono, remain closed due to the measures to curb the spread of COVID-19.
Some of the best performing schools in Mukono have missed out on the usual celebrations due to COVID-19 pandemic currently ravaging the world. Some of these include Seta Junior School Mukono Campus, St. Francis Education Center Namaojolo, Little Angels Mukono and Victor's Christian Junior School Mukono. The head teacher, Seta Junior School Mukono, Achiro Agnes, says that although they were affected by the pandemic, e-learning helped them and candidates managed to scoop good grades.
Kiraga nti gye tulaga tulengera kino tetukoze n'abazadde bagenda kyewuunya tufunye first grade 10 ku 10 abaana bonna bafunye first grade 4 tufunye 17
ez'abaana bano kuyita subject yange we bakola olupapula ina lulaba namanya bumanya nti wano tewali mmere bajja kusamba busambi and indeed.
A few pupils found at their homes were visibly happy with their grades. They appreciated the input of their teachers and parents, mostly during the lockdown.
I'd like to thank my parents, my teachers, and everyone who has been able to.
Era olwokubanga tuli mu muggalo guno bitunyigiriza nnyo naye era nsanyuse.
Elsewhere in Buyikwe district, an 11-year-old Mulonji novice emerged the best pupil at Sachu Primary School after he scored aggregates 5 in the 2020 UNEB examinations. Mulonji wants to become a lawyer.
I would like to become a lawyer in future. I encourage my fellow pupils to become focused. I thank my parents for the support and
we congratulate the candidates. Schools are still silent and closed. Even in Tororo, where our reporter visited a number of schools, celebrations are still held in people's homes.
On a day like this, one would get a beehive of activities in different schools across the country as they celebrate performance of their candidates. But due to the COVID-19 lockdown, several schools in Tororo remained empty with neither pupils nor teachers due to the ongoing lockdown. In schools visited, quietness and emptiness is what welcomed a would-be visitor. In a few other schools like Toro Parents Primary School, we found some teachers with their best candidates jubilating the unexpected results. Here, out of the 111 candidates that sat, 56 passed in first grade and all the rest in second grade, with their best getting 6 aggregates.
Altogether, we had 111, and they are all in 1 and 2. We don't have any 3 or 4. Or even a division U.
Much as these celebrate the good performance, to Martha, the result is their worst in the school's history.
We've been performing much better than this, but looking at what happened, we had to accept. Actually, when I called one of the directors, she was happy and she said, feel free. That is the effect of the lockdown.
Her plea is for government to consider reopening of schools in a phased manner or quicken the process of providing learners with study materials.
If at least they can give these home study materials and facilitate the teachers who are going to do this, I think that can work. the children will come back when they have something other than what is going on right now. Every child is on his own. The parents are busy doing this. The children are moving here and there.
About the quietness and emptiness in some schools, Martha attributes it to the failure by most teachers to afford the cost of living within schools.
Teachers are renting. Some of them have been sent out of their houses where they are renting. So as I talk, these results came out when teachers had left their places where they were staying, maybe where they were renting. That's why you'll find when you go to a school, you don't get anybody.
In Tungamo, P7 leavers have been advised to be patient and wait for the era of COVID-19 to end and resume their studies. This call was made by the Deputy Cow in Tungamo district after the release of PLE results.
Unlike other previous years, the release of this year's PLE exams was done scientifically due to the fear of contracting coronavirus. Candidates were found at their homes since movements are restricted.
I want to thank the Lord for helping me get aggregate 8. I want to thank my family members.
And got aggregate 6. I was hoping for aggregate 4, but I knew I would have done better, and I think I will keep on. I will try to do better than I had done in my PLE.
Some of the directors and owners of different schools also explained the situation.
Have been affected in 3 ways. Parents have been affected, our learners have been affected, even the teachers were affected psychologically. But what we have received, we thank the Lord because we have managed to get 58 in first grade, then 15 in second grade.
And to be sincere, we have 45 first grade and 12 in Division 2. So we really congratulate our parents, our teachers, all the staff members.
The Deputy Cow in Tungamo district wants all successful candidates to focus on helping their parents and get accustomed to home course until this pandemic is over and the lockdown is lifted.
Nkabire nimbashaba nobu amashomero garabe gatakigirwe behangane ekikurba concentrating ahamirimo eyo kubombeka eyo muka nko kuteka okureberera amatungo gibine rero bategererezeho government aherabe yabase kwigura amashomero bagarike omu mashomero.
I'm advising all parents, all stakeholders, all guardians who are with these children, do not get tired. Let's keep calm and wait for this disease to go, and let's ensure that we keep the SOPs like they have been outlined by the Ministry of Education and Sports.
Edwin Yachuara, UBC News.
We're taking a very short break. On return, we'll see business, international, and sports news.
Today in history.
Halfway through a flight from Amsterdam to Malaysia, a passenger plane was shot down over the war-torn in Ukraine, Russia. The plane took off from Amsterdam at 10:31 GMT and it had 298 people on board, most of whom were citizens of the Netherlands. All 298 people on board, most of whom were citizens of the Netherlands, died in the explosion. This was the second Malaysian air flight to disappear in 2014 after Flight 370 crashed over the Indian Ocean on the 8th of March 2014.
As the financial year 2020-2021 draws to an end, URA has put measures in place to facilitate taxpayers to file their returns and pay taxes within the set deadline. All our offices across the country and the URA Contact Center shall remain open to provide extra support to our esteemed taxpayers. Additionally, we have extended our contact center service hours from 8 a.m. to 11 p.m. Monday to Friday and from 9 a.m. to 3 p.m. on Saturdays and public holidays. In light of the COVID-19 risks, we encourage taxpayers to reach us through our improved contact center and other online platforms instead of making physical visits to our offices. For online support, please reach us through our toll-free lines 0800 117 000 or 0800 217 000. Email services@ura.go.ug. Website ura.go.ug. Social media: Facebook URA page, Twitter @URA Uganda. URA Customs Help Tool, help.ura.go.ug/login. URA appreciates all taxpayers who have duly fulfilled their obligations. Stay safe and let us all observe the standard operating procedures to prevent further spread of the COVID-19 virus. Stay safe as we develop Uganda together.
Uganda Revenue Authority, developing Uganda together.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
COVID-19 chijja kugwa. If we get vaccinated now, observe social distancing, wear a mask properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
In efforts to improve quality assurance and Uganda's competitiveness as a tourist destination, Uganda Tourism Board is set to undertake a nationwide grading and classification exercise of hotel and accommodation facilities. As a member of the East African community, Uganda subscribes to the East African Grading and Classification Criteria, a system denoted by stars ranging from 1 to 5. The grading and classification exercise will be crowned by the awarding of star ratings to facilities found compliant to the EAC minimum standards. This is therefore a call to all accommodation and facility owners and managers to register and get licensed by UTB as a requirement and get ready for participation. For more information, visit www.utb.go.ug or email qualityassurance@utb.go.ug for details. Uganda Tourism Board, promoting tourism together.
The Universal Periodic Review, UPR, is a unique process under the United Nations. It involves peer review of the human rights records of all UN member states every 4 years. The ultimate aim of the UPR is to help improve on the human rights situation in all countries through technical assistance and cooperation. Uganda will be reviewed in January 2022. This is an opportunity to raise international advocacy on Uganda's human rights situation. The National Coalition of Human Rights Defenders Uganda is coordinating all CSOs to participate in the CSO alternative reporting process in liaison with the Ministry of Foreign Affairs. For more information, email info@hrdcoalition.ug or call 0772 484 504.
UBC Business News tonight. The Parliamentary Committee on Task Force on COVID-19 has inspected Entebbe International Airport. The committee wants an urgent meeting with all stakeholders, including Civil Aviation Authority and the Ministry of Health, to address some of the facility's challenges.
Members of Parliament led by Bukuya County MP Dr. Michael Bukenya have been at Entebbe International Airport for a fact-finding mission. Dr. Bukenya says that there is need for an engagement with all stakeholders to bridge any gaps that might lead to further spread of COVID-19 in the country.
And what we've established, that actually the health services in as far as COVID-19 are concerned at the airport were privatized. They are run by private companies with the supervision of Ministry of Health.
Ministry of Health is responsible for quality assurance, or a body that Ministry of Health authorizes from within itself to ensure that quality assurance is given.
The parliamentary committee also held a meeting with the Civil Aviation Authority and inspected some of the facilities at the airport to see how they are adhering to the set SOPs.
The Civil Aviation Authority has given a free will and entrance to some countries without paying and checking them again here. However, Ugandans coming from the same country, coming back here, are tested and they pay a lot of money.
Passengers from those category 2 countries, all of them on arrival, on top of the COVID test that they have, they are supposed to undertake another PCR test at their cost of $65 US, which is equivalent to around 250,000 Uganda shillings or thereabout. So any passenger in that category is supposed to undertake that test and pay that money at their cost.
They promise to have more interactive meetings with the Ministry of Health and Civil Aviation Authority aimed at preventing further spread of COVID-19 across the country.
Welcome to international news. Kenya's President Uhuru Kenyatta, in his capacity as the chairman of the African Leaders Malaria Alliance, has endorsed the appointment of 2 special envoys to help accelerate the fight against malaria on the continent. The 2 nominees of ALMA are Ambassador Anthony Okara from Kenya and Professor Sheila Tlow from Botswana, who were endorsed and commissioned by President Kenyatta at State House, Nairobi, during a virtual meeting convened to receive the 2021's first and second quarter performance report of the agency. As part of the broad mandate to the 2, the envoys have been tasked to work with the continent's regional economic communities, including the East African Community, Southern African Development Community, that is SADC, and the Economic Community of West African States, ECOWAS, to prioritize the fight against malaria in their programming. Kenyatta applauded ALMA for the progress made towards the establishment of a digital malaria repository for the continent, saying the database will assist African nations to share best practices. Kenyatta commended ALMA for the growing involvement in Africa's youth in the fight against the tropical disease and called for the establishment of a continental youth army to boost anti-malaria efforts.
COVID-19 chijja kugwa. If we get vaccinated now, observe social distancing, wear a mask properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
Sports Club Villa has hosted the first ever Congress, which is reserved for its registered partners under the Villa Members Trust. This process is a precursor to ending a 2018 agenda that aimed at sorting various issues at Uganda's most successful football club, as John Barnes Sentamu tells in this one.
The first ever Sports Club Villa Congress meeting has been hosted virtually. This is a culmination of events of 2018 that caused formation of an interim committee to manage matters at the club following Ben Emmanuel Misaga's end of term as club president. The interim committee was primarily required to perform a set of functions, importantly solving the ownership question that was solved by formation of a Villa Members Trust. The situation at Sports Club Villa was closely monitored at Federation of Uganda Football Associations, whose president, Engineer Moses Magogo, is a self-confessed Villa fan and has played a key part in this process.
We cannot continue in the circumstances. We can only continue through reorganizing the club. I'm sure people have very many different ideas, and our divergence in opinion is not in any way limited. We just look at things differently. And what should come first with the sports club?
The Congress aimed at, among others, passing statutes, securing an electoral roadmap, and importantly informing members about the club's sporting and business analysis and strategy.
This being the inaugural Congress, we had a draft proposed draft statutes for the club that would run the club. And this has been deliberated by the members and agreed, and they have agreed to have it passed as being the supreme document that governs the club activities. The other thing that we had come here to do is to spell out the roadmap to elections, and this has also been debated by the members. And a path has been mapped out, and as such we are looking to holding our first elections under the Villa Members Trust on the 28th of August. We believe that this is still a score which will also allow our club to go ahead and be able to operate within the new structure as is expected.
It was attended by two founding members, Fred Guy Kauma and Eliab Kamya, and also former President Ben Emmanuel Misaga.
Today, we have officially got a Congress which is not yet to full capacity, but a Congress of people willing to upgrade our club to a status which can be admired all over the world.
The Congress suggested a 2.1 billion budget for next season and plans to secure money through various sources. These include a sale of merchandise, gate takings, paid-up members, sponsorships and partnerships, but importantly a fund where members can voluntarily offer and donate. The club also plans 8 new recruitments for the upcoming season with 100 million shillings put aside for that, but one wonders how they will solve the 500 million plus deficit that they face. John Barnes, Sentamu, reporting.
And that will come to the end of UBC News tonight. Thank you so much for watching. My name is Michael Jordan Lukomwa with Mohammed Mugalu and the whole team. We wish you the best of this Sunday. We'll leave you with the weather forecast reports. Bye-bye.
Thanks for tuning in once again on UBC. Kutesa Mili with your weather update. We are still having thunder showers in most parts of the country, having the highest of 6.5 millimeters across Kampala being reported, in Entebbe with 4.4, Kitgum with 2.5 millimeters of rainfall. This is due to the high over the tip of South Africa that has pushed the rainbow far north of our country, plus the moist easterlies coming from the Indian Ocean towards our country. Not forgetting the local effects bring us the weather that we are experiencing lately. Tomorrow morning, though, we expect to wake up with sunny intervals in most parts of our country, apart from some few areas like across Arua and that's around the lake showers that are expected to have light showers. Afternoon hours, we expect a pick-up of thunder showers in most parts of the country, but mainly in the western part and the north. That is expected to have thunder showers, but across the lake showers is expected to continue with sunny intervals. Temperature is up to 30 degrees of maximum across the Karamoja regions and the northern part of our region. Across the lake showers, 28 and 20 in Capital State, Kampala also, and Kabail Highlands with 25. Kasese pretty hot a little bit with 31 degrees of maximum. You is moving out of Uganda, touring other cities across the globe. We are forecasting sunny intervals across Nairobi with a maximum of 23 degrees Celsius. Lagos and New York with light showers with a maximum of 29 degrees Celsius across New York. Dubai is reporting mist but with a maximum of 38 degrees Celsius. Moscow with sunny conditions. Thanks for tuning on with us again on UBC. I remain Kutesa Billy. Stay tuned and see you tomorrow.